The dangerous air quality for millions of Americans. 13 states are on alert as we deal with that wildfire smoke from Canada. We're going to be tracking where it's headed and what it means for our health. But first, Trevor Ault starts us off in New Jersey. Good morning, Trevor.
Good morning, Robin. It is going to be an alarmingly hazy day for tens of millions of Americans. What's usually a gorgeous view from this vantage point of Manhattan is completely shrouded in all of this smoke. And New York City right now has some of the worst air quality of any major city in the world. And the smoke stretches so far that even Detroit is also up near the top of the list. All of this, the remnants of hundreds of Canadian wildfires that continues to drift further into the United States. This morning, wildfire smoke blanketing the skies for millions of Americans.
There's the red sun again.
National Weather Service issuing air quality alerts all over the Northeast, stretching west to Ohio and even as far south as the Carolinas and Georgia.
It's very strange. I got up out of the subway and it looked like a zombie apocalypse.
Overnight, New York City's air quality registering as the worst of any major city worldwide.
It's kind of got a yellowy haze to it.
Millions of phones getting alerts like these. The city's air quality index peaking above 200, a level considered very unhealthy, particularly for the elderly and those with respiratory issues.
You smell it and feel it, yeah.
The immediate health risks are worsening of asthma and worsening of allergies. This is actually probably the worst I've seen the numbers.
Sports, recess, and outside play canceled for millions of children across the region.
I woke up this morning and went outside, and it was very strange and just sort of an eerie feeling.
Officials say the cause, wildfires in Canada. Over 10,000 miles of Canadian land has been scorched so far this fire season, an area larger than the state of Vermont. With 26,000 people evacuating from their homes.
Across the country, there are currently 413 wildfires burning, and 249 of those fires are deemed out of control.
And of course, all this smoke contains very tiny particles that can get into your lungs and even into your bloodstream. And while it's not an immediate gross concern for the general public, experts do say if you're trying to protect yourself, we all have masks now, you would need a respirator-grade mask, stronger than an N95, to work in these conditions. So if you are vulnerable, elderly people, pregnant women, you all should consider maybe staying inside. Rebecca?
Important precautions, Trevor, and we'll have more from our chief medical correspondent, Dr. Jen Ashton, in just a moment. But we want to turn now to our chief meteorologist, Ginger, in Georgia. And Ginger, how long do you expect this to last, and where does it head next?
Rebecca, we've been in this stuck pattern now for almost a week or more, the United States in general. But this low pressure system that's bringing in the winds that are bringing that type of smoke all the way south to here in North Georgia by later this afternoon, that is not moving until the weekend. So let me talk you through this. We spoke with NASA scientists who said that the EPA has been tracking this type of air quality from smoke from wildfires since 1999. This will likely rival and probably surpass the worst, which was back in 2002. You saw all those air quality alerts from South Carolina up to New Hampshire and Vermont, but look where the worst of it is this morning, west of Philadelphia into Delaware. Watch the smoke plume as we put the forecast on here, and watch for the deep, dark red and purple colors. That low pressure system swirling counterclockwise, George, going to bring in that orange and red down to Atlanta and even Huntsville by this afternoon, really thick up through the weekend. We're going to clear it out by early next week.
Okay, Ginger, thanks very much. Let's bring in Dr. Jen right now. We heard Trevor there talk about the risk. Break that down.
Yeah, I think the key thing here, George, is that we usually say, oh, you know, if people have underlying respiratory or pulmonary conditions, they're most at risk. While that is true, I want to be clear here. We are all at risk. This is fine particulate matter. You cannot necessarily see it in the air, but you can feel it. And this can come on suddenly, masquerading almost like seasonal allergy symptoms or even an upper respiratory infection. But we know there's a situation. So assume we are all at risk. And obviously, things that you can do, reduce or avoid going outdoors, really, unless it's necessary, because these fine particulate matter particles can get into the eyes and lungs, causing symptoms like burning eyes, runny nose. It can even precipitate bronchitis. And obviously, if you have underlying cardiovascular or respiratory conditions, you are most at risk.
But you're saying everyone everyone.
Absolutely.
Yeah.
I mean, this is a true environmental public health issue.
What other precautions can we take then?
Listen, I think common sense precautions really apply here. If you have to go outside, put a mask on. Otherwise, keep your indoor air as clean as possible. Run your air conditioning if you have it. Be in touch with your healthcare provider if you have asthma. But again, N95 or KN95, the best we have right now. If you have to go out, put one on.
I know you'll be talking about a lot on
Yep.
GMA3
For
as
sure.
well. All right.
Yep.
Thanks so much, Jen.
You bet.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.